Hello everyone. I would like to welcome you to our informational webinar on the new Investment Casting Institute Healthcare Program. Please welcome Kevin Kennedy from the program sponsor, the Small Association Leadership Alliance, who over the next 20 minutes will give you all the important details on this exciting new membership benefit. Kevin?
Thank you very much. Welcome everyone. My name is Kevin Kennedy. I'm with the Small Association Leadership Alliance. We are the sponsors for the healthcare program that we're going to talk about today. When we started this program, we had two main priorities. It had to be available to all members in all 50 states, so it's a program that can travel with you and your members. It also had to reduce costs in a meaningful way. What we've put together here is really an effort to simplify what's become so complex. It's a high-end, affordable healthcare solution that offers a great choice of healthcare options, and on a national basis, we found that it's lowering costs by as much as 60% when compared to traditional healthcare found on the exchanges. The program itself is really an alternative approach to traditional health insurance. What we have done is partnered with two main partners, Apex Management Group and Sedera Health. When folks first sign up, they first choose the plan that best fits them and their family from Apex Management. There are two plans to choose from, and I'll go through them both in some detail, but they offer coverage for preventative care and smaller needs. They then pair that plan with a plan from Sedera Health. Sedera Health is a medical cost-sharing company, and I'll talk about Sedera in some details here. But really, Apex and Sedera, along with some of our other partners, equals a comprehensive, cost-effective alternative to traditional health plans. Let me talk first about Sedera. Medical cost-sharing dates back to the early 1980s, where different churches or congregations would get together and form an organization through which their parishioners or members could share in each other's healthcare costs. They would all contribute monthly to the organization, and then costs would be shared out through the organization. Sedera's parent company is called the CARES Group, and the CARES Group was formed in the late 80s or early 90s. And the CARES Group is a medical bill negotiating company, and they are the company that many of these religious-based organizations turn to for their larger costs, their larger bills, when they need them negotiated. The CARES Group, 5 years ago, formed Sedera Health, built upon the same principles as the other medical cost-sharing groups that I mentioned, but without the religious component. And Sedera's objectives are really all of our objectives. It's compliance and credibility, it's lowering our monthly expenses, and reducing our out-of-pocket costs. Medical cost sharing in general offers big savings over health insurance. It's healthcare through community versus healthcare through insurance. Industry-wide, as of the end of 2017, there are more than 1 million members sharing more than $1 billion annually for their healthcare. It also offers freedom from networks. So if you or any member of your family have a medical need, you can go to any hospital you want or any specialist you want. Sharing begins at what's called your IUA, your initial insurable amount on a per-need basis. That's what you're responsible for paying out of pocket, and there are 5 levels to choose from, and I'll talk about all of those in some detail. Here's a quick graph to give everyone a visual on how the medical cost sharing has really grown, and you can see when the uptick really happened there in 2013, when all of our medical costs really started to increase in an unsustainable way. People look for an alternative, and that's the alternative we're talking about here today. This program has 3 main components: large costs or needs, and that's where Sedera comes into play. And those are surgery due to an accident, hospitalization, an emergency room visit, a cancer diagnosis, things of that nature. And there are small to medium costs, and I'll talk about those in some detail as well, and then, of course, preventative care. But let me continue talking about Sedera here and talk about the large costs or needs. Sedera talks about any of these unexpected or unforeseen medical expenses as a need. So what is a need? A need is one or more medical expense caused by a single accident or illness. As you can see on the graph there on the left, this is an individual who broke their leg. So there was a cost for the ride in the ambulance, to stay at the hospital, perhaps surgery at the hospital, diagnostic imaging, crutches, pain medicine, physical therapy. All of those costs, whether it takes a month or whether it takes 2 years, but all of those costs are wrapped up into one need. Now, the individual's responsibility here, like I mentioned just before, is the IUA, the initial insurable amount, and that's what members pay before sharing can begin. Our program has 5 levels to choose from. You can have a $500, $1,000, $1,500, $2,500, or $5,000 IUA, and that's what you're responsible for paying for. So in the situation on the left there, when someone who broke their leg, if all of those bills were $10,000 and you had the $1,000 IUA, you would be responsible for paying the $1,000. The balance of those costs would be shared through Sedera, and the funds would be sent to you to pay the balance of the bills. Now, if you're an individual, you're responsible for the first 3 needs in any given year, or a family, you're responsible for the first 5. As a practical matter, we all have far fewer of that in terms of large unforeseen medical expenses in any given calendar year. But if you did exceed the 3 or the 5 as a family, you would not have to pay your IUA. All of that need would be covered 100%, and you would not have to pay the IUA at all. Here's a quick example of a real life example. This is a young child with a persistent ear infection. Their family had traditional insurance with a $5,000 deductible. After a series of antibiotics and booster injections, they visited an ENT who inserted tubes into the child's ears. As you can see there on the left, that would be the approximate cost with traditional healthcare insurance. And then on the right, if the family had the $500 IUA, obviously they would only be responsible for paying the $500. Let's talk about some nuances to the plan. That's membership, medications, and pre-existing conditions. And let's talk first about medications. There are 2 types of medicines we all take, those that are curative and those that are maintenance medicines. The curative medicines are the ones that we take, and that, similar to my example with the broken leg, we take them for a period of time. There's an end date to when we stop taking those medicines. It's when we're cured. With Sedera, the costs for those curative medicines are wrapped up and shared with the community. So those costs will be shared with Sedera and paid accordingly. These would be antibiotics, pain medicines, chemotherapy drugs, anything that's related to a need, to an illness, and when there's an end date to when we stop taking them. Then there are maintenance medicines that many of us take, such as blood pressure medicines and cholesterol medicines. I myself take maintenance medicines for my rheumatoid arthritis. This program has 3 options for us to choose from, and the majority of people, including myself, have prescription coverage through the Apex plan. And I'll talk about Apex in just a few minutes, but if you recall, that's the first choice when people sign up. They first choose the Apex plan that best fits them and their family, and then they choose the Sedera plan. So the Apex offers great prescription coverage. Folks can also choose to use GoodRx, which is a discount pharmacy program. We can get great discounts nationwide. Or folks that have a more significant regimen of maintenance medicines, or perhaps take maintenance medicines that are above and beyond the normal, if you will, such as more significant drugs. They may want to sign up for Liberty Benefits, which is an add-on for $27.50. But regardless of what medicines you take and how often you need to take them, the program has a great way for all of us to get the pharmaceuticals that we need. When members sign up, they also commit to living a healthy and balanced lifestyle. Obviously, making smart choices with diet, exercise, and lifestyle can greatly improve one's quality of life, but it also helps keep all of our medical expenses down. Members do commit to not use illegal narcotics and not to operate a vehicle while intoxicated. So what does that mean? That means that if you're operating a vehicle while intoxicated and you get into a car accident and you have medical bills, you cannot share those bills with the community. There's some self-responsibility here that we all take on, and again, it's all in an effort to keep our medical costs low. Also, tobacco users are certainly welcome to join. There is a $75 surcharge per month, and if you're over the age of 50, there's a $25,000 per need sharing limit for the top 4 diseases associated with tobacco usage, which is heart disease, stroke, COPD, and cancer. Let's talk about pre-existing conditions, and this is a slide that I'm going to take my time on. If you see the top 4 there that are listed, high blood pressure, high cholesterol, sleep apnea, or non-insulin dependent diabetes, if you have any of those 4 and they are well controlled with medicines, they do not have any sharing restrictions. There's not an issue there at all. If you have any other pre-existing conditions, such as myself with my rheumatoid arthritis, there are sharing restrictions. So what does that mean? That means in year 1, should a need arise from my rheumatoid arthritis, as an example, meaning a surgery or something of that nature, resulting from my pre-existing condition, I could not share the expenses in year 1. Year 2, I could share up to $15,000. Year 3, up to $30,000. After that, it's fully shareable. Now, when you sign up, there's a 3-year look back, and you have to disclose any medical condition you or any member of your family have had in the prior 3 years, and that's how your pre-existing conditions are established. So for me, again, I had to disclose my rheumatoid arthritis. Now, my RA being what it is, I've had it for many years, and it certainly did not preclude me from joining. It's simply a matter of some blood work and taking my medicine. But this is certainly a slide that everyone with a pre-existing condition needs to be aware of and understand, obviously, how it works. Some common examples that people have had, again, rheumatoid arthritis is one, hyperthyroid is one, where there are pre-existing conditions, but they would not necessarily preclude them from joining. Now, obviously, if you had an active cancer or were currently pregnant, you would not want to join. That would certainly create a financial burden for you and your family in year one. So, again, those of us with pre-existing conditions are already very well aware of what the nature is. And again, this comes into play if a need or medical event occurs as a result of that pre-existing condition. So those are large costs or needs. That's surgery from an accident, hospitalization, an emergency room visit, a new cancer diagnosis. That's how the costs are shared. That's how they're paid for. And again, your responsibility is that IUA, the initial insurable amount that you and your family can choose from. I'm going to switch gears now and talk about small to medium costs. And the program addresses these in several ways, but these are the run-of-the-mill type events we all have: a cold, a sinus infection, the flu. The first option for folks is telemedicine. Included in the program here is a subscription to Teladoc, and Teladoc is the largest provider of telemedicine in the U.S. If you're not familiar with telemedicine, that's exactly how it sounds like. You would connect virtually with a doctor over the phone or through your computer, tell the doctor what your symptoms are. If necessary, that doctor can send a prescription to your local pharmacy for you. Teladoc is actually the largest provider of telemedicine in the U.S., and there are almost 75% of the Fortune 500 companies now offer telemedicine. In 2015, it was less than 25%, so it's truly gaining steam. And the reasons are simple. It lowers costs. Instead of having to go to a brick and mortar building to the urgent care facility or your primary doctor, you can connect with a doctor from your business or from your house or from wherever you might be and get the care that you need. Also included here is SecondMD. SecondMD is a great way to get a second opinion on anything you and your family are going through. The doctors that work at SecondMD are based at some of the most prestigious organizations in our country, such as Johns Hopkins and the Mayo Clinic. And if you're having an elective surgery, Sedera actually requires you to get a second opinion, and you do so through SecondMD. And if you do get that second opinion through SecondMD, as you are required to do, Sedera will actually take $250 off your IUA. So if you're having elective surgery and your IUA is $500, once you get that SecondMD opinion, you only have to pay $250. There's also a member advisor or coach that's included here, and you can see some of the options there. But now I'm going to switch gears and talk about Apex, because Apex offers coverage for small to medium costs and also preventative care. So again, when you first sign up, you first choose the Apex plan that best fits you and your family, and then you pair it with the Sedera. So now I'm going to talk about the Apex plans, and there are two great plans to choose from. The first is the high deductible health plan, or a basic MEC plan. It's minimal essential coverage. It offers 100% coverage for all preventative care needs. As you can see listed there, 21 for adults, 28 for women, 31 for children. That's yearly physicals, vaccinations, colonoscopies, mammograms. Those are all covered 100%. This plan then provides a framework for a health savings account. So with a health savings account, you then put away tax-free dollars to be used for any qualified medical expenses, such as dental, vision, prescription, doctor visits, and also the IUA with Sedera. So it's a great way to put away money for a medical need when it occurs. I'll be honest with you, the people who choose this program or this option are healthier than I am. And it's about 25% of folks who choose this option. And there are folks who do not have to go to see the doctor on a regular basis like people such as myself do. The second option for folks is the Advantage Plan. The Advantage Plan, once again, is 100% coverage for all preventative care needs, 21 for adults, 28 for women, 31 for children. It then has the co-payment structure for medical care. So for folks like myself who do have to go see my rheumatologist or any sort of specialist, it's a $50 copay. To see a primary care physician, it's a $20 copay. But the Advantage Plan also offers prescription drug coverage. So for those of us who do take maintenance medicines, like I mentioned before, this will be the plan for us. You can see there's Tier 1 and Tier 2 generics, Tier 3 preferred brand names, and then Tiers 4, 5, and 6, which are specialty drugs, chemotherapy-type drugs, stronger, more specific drugs. When I first talked about Sedera, I made note that with Sedera, you can go to any hospital you want or any specialist you want. With Apex, which is the other half of your plan, you have to operate within the multi-plan network. And the multi-plan network is actually one of the largest networks in the U.S. There are more than 900,000 participating providers, and it offers great coverage nationwide. And this will be the network you have to operate within when you go see your primary care physician for, say, your annual physical. Or if you're scheduled for a colonoscopy, you would have to have a gastroenterologist who operates within the network. Or for me, with my rheumatologist, she is obviously within the network, and that's who I go to see. Here's just a quick, simple way that you can search for doctors by specialty or by name within any given zip code and get the results that you need. And all of this is on the website as well, so you don't need to memorize it. But let's talk cost. So the first options you'll be faced with choosing is the Apex plan, and here's the plan here. On the left, you have member only, or member and spouse, member and just the kids, or member and the entire family. That second column there is the high deductible health plan or basic MEC plan. You see the pricing there, and again, that's the plan that offers the option and framework to have a health savings account where you can put away some tax-free dollars for future medical needs. The third column there is the Advantage plan. Again, that's the program I'm on because it has a copayment structure for when I see my rheumatologist, and also the prescription drug coverage, which I also need. The area you have on that top one there, that's actually the program I am on for $144.59 per month. You can then pair that with the Sedera program that makes the most sense for you and your family. Again, you can choose from an IUA that is $500, $1,000, $1,500, $2,500, or $5,000. For space reasons here, we only have the $1,000 and $1,500 listed. Obviously, the higher the IUA, the lower your monthly cost. On the left, just like with Apex, you have member only, member and spouse, member and just the children, or member in the entire family. And going across the top, it's segregated by age, those in their 20s, 30s, 40s, 50s, and 60s. And again, the arrow is the program I am on. And here's the monthly total for the program that I am on. Again, I'm between the age of 40 and 49. I pay $320.10 per month. And I'm on the $1,500 IUA. And I chose that just because it's middle of the road, and that's the amount I'm comfortable with should a medical event arise. And something to note here, obviously the $320 is about half of what I was paying when I was on traditional health insurance. But also my max out of pocket is far less, because the most I would pay through Sedera would be 3 IUAs in every given calendar year. God forbid if I had 3 such needs, but that would be $4,500 as opposed to my old plan that had a $6,000 deductible. So it's a program, regardless of where you live and regardless of your sex, this is the amount you pay, and it can also save you money on the back end as well, should a need arise with a lower IUA. On our website, you can certainly find all of the following: the current rate sheets, details on the Sedera plan, details on the Apex plans. There's a great FAQ on the telemedicine, for those of you not familiar with it, as well as 2nd.MD, and also the multi-plan provider search, so you can check and see if your primary care physician and if you're any specialists that you may see are in network. A brief summary of the offering. It's available, like I said, in all 50 states, so it can truly travel with you. It does not need an employer sponsor, so individuals can join. They can be full-time, part-time, or seasonal workers, hourly or salaried staff, and the monthly cost can be paid by the individual or the employer. It can be set up either way. And obviously, it's a terrific benefit for companies to offer. And again, the savings we're seeing is about 60% when compared to traditional healthcare on a national basis. It truly varies by where you live. Some folks like myself, we're seeing savings around 50%. Other folks are seeing savings of 200% or more. But with that, I certainly want to thank you all for joining us today. And again, I invite you to visit the website and reach out to us with any questions you may have.
Thank you, Kevin. If you'd like more information, please visit the website, or you can also send an email to our Healthcare Support Center or call the toll-free number listed above. Thank you, everyone, for joining us today.